Dear doctors, at the outset, I would like to thank the AIM Academy for giving me an opportunity to share this particular topic, which is a very hot topic for everybody today, especially for the dental surgeons. Okay. Now, in this one and a half hours webinar, we are going to see what are the things we as the dentist should do actually to do our practice in this particular COVID-19 pandemic, what we call it as a coronavirus or COVID-19 practice. All of us knows that COVID-19 is an infectious disease which is caused by the recently found virus which is known as the SARS-CoV-2 or coronavirus. Before the outbreak, originated in Wuhan, China in December 29, there was no information about this virus. Okay. Now everybody must be very eager like to know what is this SARS-CoV-2 virus. Okay, so this SARS-CoV-2 virus, it's basically a nidovirus. Okay, I'm going to talk in detail a little bit about the exact structure of the virus because that is very important for all of us as a dentist to know about the structure of this virus. Okay, and the weight of this particular virus or the size of this particular virus is about 30 kilo base. Okay, and basically it's an RNA virus. Okay, now before I will start my presentation, I would like to take you just briefly to the history of different types of the pandemics which has happened in the world in last decades and last few so many years. Okay, it is very truly said by Dr. Tedros, who is basically the chief of WHO. Everybody knows World Health Organization. He is the Director General. What he says, we cannot say this loudly enough or clearly enough or often enough. All countries can still change the course of this pandemic. Now, what does he wants to say here to all of us? What is the message he wants to give us? If we want to study any disease, there are a lot of literature which is available in the literature. Okay, there is a lot of things which are available, but this COVID-19 or the coronavirus, okay, as it is the breakdown happened almost 6 months back in China in December 2019. So there is not much literature, not much studies which are available, how to manage it, what are the things, what are the medications, is there any vaccine which is available, and that is what exactly he is trying to point it out to every country. And it is all dependent on those countries, like how we can change the course of this particular pandemic. Okay, these are just few diagrams, few pictures which I took from the internet. So there are few pandemics which has happened previously all over the world, and this is like the historical perspective of, you can see on my screen, the Nidovirus. As I told you, that SARS-CoV-2, which you can see here in the end, is basically a Nidovirus, which is from a group called as an RNA virus. Okay, the similar kind of situation has exactly happened around 110 years back, if you know. And what is that? We call it as a Spanish flu. Okay, and during that also there were a lot of issues, lot of problems, lot of human life was disturbed, but then slowly the better day came, and this is exactly what is going to happen with the SARS-CoV-2 virus also. Slowly the better days will come, but we have to fight this particular situation today. And in this particular fight today, the doctors are the warriors, we can say. Okay, so this is regarding the historical perspective. Okay, as I mentioned, we must know what is the structure of this coronavirus. Okay, now it is very important for us to know the structure of the coronavirus. You can see here it's an RNA virus. Okay, so there is a strand of ribonucleic acid, you can see here, and this particular strand of ribonucleic acid, basically it is covered with a bilipid layer. You can see this is a bilipid layer. Okay, and there are projections, what we call it as the spikes. Okay, and because of these projections from these bilipid layers, the spikes, they are basically called as the trimers. Okay, what happens, this particular virus on microscope looks like a crown of the king, and that is the reason why this particular virus is named as a coronavirus. It looks like a crown, and that's the reason the name coronavirus. Okay, now for us it is very important to know, as you must have since last 5-6 months, you must have heard like this virus, you go on washing your hands very frequently, because this particular bilipid layer, which you can see, we can appreciate here, it usually get washed out with the help of a soap. Okay, when we wash our hand with the help of the soap, this bilipid layer usually get washed out. Okay, and this particular virus, without the bilipid layer, it has no value. That a particular RNA stand, if we damage this lipid layer, which you can see in the periphery, if it's get damaged because of the soap solution, this viral has no activity. It has, and that is the reason, with the help of the soap solution, it gets usually washed out. And that's the reason why soap is one of the best medium to wash out this virus from our hands and other parts of the body. Okay, everybody knows the modes of transmission. Okay, there are many things which have been given by the World Health Organization, but there are two very important things how this particular virus get transmitted as far as the humans are concerned. Either it is transmitted from human to human, which is called as a transmission through the respiratory droplets, and which comes through either coughing or sneezing. Okay, and what we call it as the fomites. Okay, so whenever somebody who is infected, he coughs or sneezes, that particular respiratory droplets, they will comes out, and those respiratory droplets, they are, which are in a size of from bigger than 5 to 10 mu microns. Okay, and they might be also available in the fecal mass species, but the infectivity of this particular fecal species is not yet studied or not yet known. Okay, but when it comes from the respiratory droplets, it is definitely going to infect the human. Okay, then from the direct contacts with the infected people or the indirect contact with the surfaces. Okay, when we sneeze or cough, these droplets, they will get accumulated on the surface. Okay, and I just wanted to mention here, as far as we are talking about the dental practice and COVID-19, when you are doing a patient, like there is a aerosol generation. I'm going to speak about this in details, but at this juncture, what I mean to mention here is, when you are generating the aerosol in your dental operatory, and this particular aerosol with these respiratory droplets, it will be there in your dental operatory. Okay, it is said that this aerosol will get settled down within 14 to 15 minutes to the base of your floor. Okay, so that's the best time when you have to open up the windows. Whatever the aerosol is there, there are different methods how we can control that aerosol. We are going to talk in details. Okay, and the third way, and as I mentioned you, by direct contact with the surfaces. Okay, more stable on the plastic and the stainless steel than the copper and the cardboard. Okay, and the virus may be detachable up to or more than 72 hours. Okay, and in dentistry, as far as dental practices are concerned, the virus can remain viable and infectious in the aerosol for hours together. So what is our aim is, we need to either do the aerosol generating procedures less, or if we really do it, we have to take the precautions. Okay, what are the precautions? I'm going to talk about this in details in the subsequent slides. Okay, now it's very important. Okay, there are three ways how this virus can enter into the human body. Okay, the one is, these are the three important membranes. The first one is the oral cavity, the second one is the nasal mucosa, that is the oral mucosa, the nasal mucosa, and the third one is your conjunctiva, your eye. Okay, and that's the reason why it is said that whenever you have a doubt, don't touch your hands to your face, because your hand might be contaminated with the virus, and if you will touch your face, that virus may get inoculated into these membranes. Okay, what exactly happens when this virus comes in contact with your membranes of the oral cavity, nasal cavity, or the conjunctiva, that is eye? It gets attached to the cell surface through ACE2 inhibitors. Okay, and that is very, very important here, because it is said that the patients who are on the ACE2, ACE is basically, this is the drug which is usually given for the hypertensive patients. Okay, it comes in contact with the cell surface through ACE2 inhibitors. It gets attached through the S protein, that is the spikes, which I have already mentioned in my previous slide. Once it gets attached to the cell, it will liberate its ribonucleic acid inside by breaking down that outer layer, that is a bilipid layer inside the cell. After that, there will be a biosynthesis and the replication of the RNA inside the cell that will actually attack the cell membrane. And after that, there will be formation of another assembly of the virus, and which will be detached from this particular mucosa or from this particular cell membrane. Okay, and that is how that particular viruses will be again liberated, again released into the oral cavity, and that is the reason the oral cavity is full of these viruses when you are infected with this particular virus. Okay, as I mentioned, there are different ways. The aerosol, one of the most dangerous way of transmission of the virus in the dental operatory, and the coronavirus is also not an exemption for that. And as I told you, the size of the coronavirus, which is about 30 kilobytes RNA load, and it is also transmissible in the dental operatory to the aerosols. Okay. Now there are many peoples who are infected with the COVID-19 who shows mild symptoms, especially during the first stage of the disease. Thus, you can still catch the disease from an infected person who only has a mere cough and does not feel ill. Okay, so what is important for us, even though the patient is asymptomatic, he might be a carrier for that particular virus. Okay, I'm going to give the take home message at the end when I'm going to conclude, but it's very important. We might have many people around us who are asymptomatic but who are actually the carrier of this particular virus. That is what we call it as the coronavirus or the COVID-19. Okay, so, and these are the symptoms. Everybody must have heard about these symptoms in last 4 to 5 months now. What are the four most commonly and the important symptoms are: the patient will have the tiredness, the body feels completely tired, lethargic, he don't want to do anything, he will be completely without energy. There will be a dry cough. Okay, it's very important. Okay, the constant coughing without expelling a mucus. Okay, this is a characteristic feature of differentiating this particular infection of COVID-19 from the other viral or the bacterial infections. Okay, the patient will have the high fever, the body temperature will be more than 37.3 Celsius degrees, and this is very, very important where we as a dentist can catch that particular patient in our dental operatory. So it is recommended when the patient visits, the first thing what we are supposed to do is check the temperature with the infrared thermometers. Okay, there are touchless infrared thermometers which are available. I am going to show you actual video how we are going to tackle the patients, and obviously there is a difficulty in the breathing which actually the patient feels. Now, why there is difficulty in the breathing? Basically, this particular COVID-19 or the coronavirus, it attacks your lungs. Okay, and the autopsy reports of the deaths which has happened in different countries, what they reported, the virus when it comes in contact with the alveoli, it changed the pattern of the secretion. Okay, and the secretion which usually gets clear with the cough, okay, is get thickened out and it blocks the alveoli, and that is how at the alveoli level there will be exchange of the oxygen will be less and the patient will have difficulty in breathing. And this is another important key for the dental surgeons. When the patient reports to you, every patient who is reporting to our dental operatory, also we should check his oxygen saturation level, what we call it as a SpO2 level. Okay, so these are the two important key points where we actually as a dentist can catch the patients, whether he is an asymptomatic patient but he is a carrier, or whether the patient is having all these symptoms. Okay, so you have to keep it in mind, the check the fever and check the SpO2 level when the patient reports to our dental operatory. Okay, now it is said that about 80% of the people recover from this particular disease without needing any special treatment. That's the very peculiarity. Okay, as I mentioned you, there might be many asymptomatic carriers around us who don't have any symptoms. Okay, and they usually gets recovered without any treatment. Okay, and what are the things we are supposed to do? I am also going to talk about how to increase our immunity, how to boost up your immunity during this particular lecture. Okay, now there are multiple guidelines which are being published by CDC, that is Center for Disease Control. Then the World Health Organization has given some guidelines. Okay, then there are some European associations who has given guidelines. Then there are Public Health England and the others who has given the guidelines. Okay, so this particular presentation is it's a combination of the guidelines which have been given by different agencies. Okay, and what is best as far as the dental surgeons are concerned, that is what we are going to talk in these subsequent slides. Okay, now what we have done, we have published a book, what we call it as a COVID-19 and dental practice, about 3 weeks back, and we named it as a GDC Nagpur Task Force for the dental practitioners. Okay, and this book is very well appreciated throughout the India by all the dental surgeons. And if anybody wants this particular copy of this particular book, you can just send me a text, or you can message me, or you can send me a mail. I will share the PDF file of this or the link where you can download this particular book. Okay. As I told you, like dental health care providers, like the DHCP, are always at the risk of COVID-19 infection at its spread. Now, you will ask me why? Because if you see the hierarchy of this particular pyramid, the dental surgeons are at the top, and the 90% possibility of the dentist to get infected from this COVID-19 or the coronavirus is there. The reason is we are actually working in an area where this particular virus is going to lie. Okay, like in the oral cavity where the saliva is there, lot of other microorganisms are there, viruses are there, where again the COVID-19 virus will be there. Okay, and that is the reason we are at the highest risk as far as getting or spreading this particular disease to the patient. Okay, and this is what I was talking to you, a practical manual COVID-19 and dental practice GDC Nagpur task force, which is already published, and you can contact me. And the three important things what we have very specifically focused in this particular manual, they are the patient selection criteria, we are going to talk in details, the reception area protocols, and the operatory room protocols. These are the three very, very important things which we are going to talk during this particular subsequent slides. Okay, now as far as the dental clinics are concerned, okay, like dental operatories are concerned, this is the model of the new dental COVID-19 dental clinic. Okay, and what we should do, we should try to rearrange our dental clinic where we can have the green zone, where we can have the orange zone, where we can have the red zone, and where we can have the yellow zone. Okay, so yellow zone, basically you can prepare your patients. The orange zone, where the non-aerosol generating procedures can be done, like you can do the extractions, you can do the orthodontic patients, you can do the other procedures where the aerosol is not generated. And the red zone, actually where you are doing the patient who are either COVID-19 positive or who are having where the aerosol generation will be there. Okay, and the green zone, as you can see in this particular diagram, is what we call it as a resting area for the staff. Okay, and then yellow zone, we are going to do the waiting area for the patient. The diagram itself is very well explanatory. Okay, and there will be a donning and the doffing area where which will be separate, which we are going to talk in the subsequent slides. Okay, as far as the patient selection guidelines, what we recommend. Okay, these are the three very important things, how the potential route of transmission of the pathogen or the virus can happen, either from patient to the dental health care providers. There is the highest possibility of the spread of this particular virus from the patient to the dental health care providers. Okay, from dental health care providers who is asymptomatic but carrier, again it may get spread to the patient. Okay, and from patient to patient, if there are multiple patients who are sitting in your operatory or in your waiting area or the reception area, there is always a possibility that this disease may spread from patient to patient. Okay, so we have to take all the precautions where we can actually stop or we can actually reduce the transmission of this particular pathogen and the transmission of this COVID-19 virus. Okay, and that is what we call it as a breaking the chain. Okay, and this is how we have to break the chain. Somewhere it says source, who is a patient, susceptible host, who is nothing but the dental healthcare provider, and then from the source there will be transmission on entry, and then pathogen again. So it's a cyclic. Okay, so we have to break the chain somewhere, and we have to take the proper precautions, proper care, so that everybody will be safe without transmission of this particular pathogen. Now it's very important, when you want to do a patient, we have to take a proper history of the patient who is reporting to our dental operatory is very, very important. Okay, everybody knows about the telemedicine. Okay, similarly, you have to ask your patient to buy what we call it as a teledentistry. Okay, so now the practice of the teledentistry is also going to grow. Okay, so take the proper history of the patient on your WhatsApp, on your video calls, on your Facebook calls. Okay, and ask all the questions which I'm going to mention. That is what we are going to promote, the teledentistry, before you give an appointment to your patient, to your operatory. Okay, it's very, very important. Okay, so what are the things we are supposed to do? Firstly, the dentist ought to be able to recognize a suspected case of COVID-19 and should not treat the patient in dental clinics. Okay, he or she shall immediately made sure to report the patient to the infection control department as soon as possible for quarantine. Okay, the body temperature of the patient should be measured, and a contact-free forehead thermometer, as I told you, like the infrared thermometers which are available. Whenever you do these things like thermometer and SpO2, and these are raised, say body temperature is and SpO2 level is down, immediately try to contact the infection control room and report that patient to the infection control room. Okay, so here the dentist will have a major role in preventing the spread of this disease, where we can actually play an important role. Okay, now a questionnaire should be used to screen the patient with the potential infection before they could be lead to a dental chair. And what is the questionnaire? Send this questionnaire on WhatsApp to your patient before you give an appointment. And very important things, what we should ask in this particular questionnaire: do you have the fever or the experienced fever within past 14 days? Have you experienced a recent onset of respiratory problems like cough, difficulty in breathing from last 14 days? Have you traveled to any other country or any other red zone area where the infection is spreading? Have you come in contact with the patient with the confirmed COVID-19 infection? Like there might be another patient in the family where this particular patient who is reporting want to report to a dental operatory may not give a proper history. Have you come in contact with the people from a neighborhood region reported to be infected, or have you recently participated in any gathering, any meetings, or had close contact with many unacquainted people? Okay, this is a questionnaire which should be sent to the patient. Okay, you will have this particular questionnaire in black and white, and you can fill it and you can ask the patient to send it back, so that this will be also important for you as well as the legal points are concerned. Okay, now if these are the important things what we should do from this evaluation. If patient replies yes to any of the screening questions which I have mentioned, and his body temperature is below 37 degrees Celsius, the dentist can defer the treatment until 14 days after the exposure. Okay, if the patient says yes, I have visited a patient who was COVID positive, but the temperature is not yet raised, that means he might be a carrier. Okay, so it is better to wait for the 14 days. Now you will ask me a question, why it is 14 days? Because the incubation period of this particular virus usually is from 14 days up to 21 days. Okay, so minimum time required is 14 days. Okay, if the patient replies yes to your questionnaire and there is an increase in the body temperature from 37.3 degrees Celsius, the patient should be immediately quarantined. You call the infection control department and then immediately report that such and such patient has come who has history of the exposure and whose body temperature is raised. Okay, if the patient replies no to all your questionnaires and the body temperature is below 37.3 degrees Celsius, we can treat the patient with extra precautions. I'm going to talk about this, the personal protection equipments, and with the minimum generation of the aerosol to the best. Okay, and if the patient replies no to all the screening questions, but his body temperature is no more than 37.3 degrees, the patient should be referred to the fever clinic or the specialized clinics for the COVID-19 for the further medical care. Okay, so the patient is having fever, we should refer him to the other physician, other fever clinics where he can be very well investigated for that particular fever. Okay, at the moment in this COVID-19 pandemic, we are going to only do the emergency treatments, and you can see on my screen these are the few important emergencies what we are actually treating nowadays. Pain from the pulpal involvement, you just open up the root canal, maybe you can use the micromotor and then just leave it. You can treat the pericoronitis, the fractures which are involving the teeth and the alveolus, broken or the dislodged definitive prosthesis, painful restorations, denture adjustment over the soreness, adjusting the appliances like the orthodontic wires, and few very important emergencies which we come across in dental surgery, in maxillofacial surgery. They are the uncontrolled bleeding, facial space infections, maxillofacial trauma, and the oral malignancies. My recommendation here is we should try to do the minimum invasive procedures. Say a patient comes to you with a trauma, so we should try to do a minimal invasive procedure, like just do an intermaxillary fixation rather than posting that patient for the major surgery. Okay, we don't know because the patient might be a carrier. Okay, and this is the consent when the patient comes to you. Every patient should be taken an undertaking, and this can be modified according to the need, according to the requirements of the any dental operatory. We can check them, we can modify them, but this is just a sample questionnaire, sample declaration, which every patient should be signed in front of the doctor. Okay, it's very, very important, because this will be another legal document which you have in case of any legal problems in the future. Okay, antibiotics definitely don't work against the coronavirus. We, the dentist, usually have an habit of prescribing the antibiotics to every disease. Okay, but virus, they are not effective against the any antibiotics. Okay, and what are the choices of the drugs? Analgesics of the following origin, like the acetaminophen, paracetamol, 1,000 milligram, 2,000 up to 2,500 to 3,000 milligram in a day in a divided dose. You can divide in 3 doses. The diclofenac is comparatively very safe, 50 milligrams in divided in 3 doses up to 150 milligrams, and the keterol trimethoprim 100 milligram. Okay, WHO in their guidelines have advised to abstain from prescribing the ibuprofen. Very, very important for we, the dental surgeons. Stop prescribing ibuprofen drug, because that will have an effect on the like ACE I have shown you, and that will increase the possibility of that particular virus to get more vulnerable to your human body. Okay, and antibiotics are to be used in cases where you feel that there is a secondary bacterial infections, and routine antibiotics you can choose according to your choice, and they can be prescribed just to prevent the secondary bacterial infection. Okay, now what are the protocols which we are going to follow in the waiting and the reception area? I'm going to talk about this in detail. We can send the poster like this, or you can print the posters, signages in your opera, and you can just hold them in your operatories. Okay, advice for the patient before they visit to the operatory, what the measures they should take when they visit to, they want to ask every patient to wear a mask. Okay, very, very important. I will show you like how we can prevent, just by wearing the mask, the possibility of transmission of this particular disease can be reduced up to 90%. I have a very good picture diagrammatic representation in the subsequent slides. Okay, limit the number of people accompanying to you. Only one person can accompany the children or the elderly. Otherwise, ask them to come alone without anybody. Wash the hands before the patient comes to dental operatory. Give them the sanitizers. We are going to talk about this, and use the social distancing media. Okay, now once the patient enters into the reception, ask him to use the hand sanitizer. Okay, we should preferably have the non-touch sanitizer dispensers. Okay, which I will show you on my video, like how we can have the non-touch, where if the patient is having virus on his hand, we don't know, because it's an invisible enemy. Okay, everybody says it's an invisible enemy of the human. Okay, so ask him to use the first thing to hand sanitizer. Okay, patient enters into the reception should be screened for the temperature and the SpO2 by using the pulse oximeter. Give a disposable bags if patient wants to dispose of his tissues or his mask. Okay, all these things we should provide them the new fresh mask. Okay, and we should give them the head caps, we should give them the shoe covers. Okay, all these things should be made available in our operatory. Whatever the things like the phones, the mouse, keyboards, the pens, etc., they should be covered with the disposable covers. Okay, or we can use the cling film so that they cannot get disinfected. Okay, this is just an example, like the cling films. Okay, these are basically nothing but the films which are used for wrapping the food. Okay, everybody, it's very cost effective also. Okay, we can use them, cut it and just throw it when you will go when you will finish up your procedures. Okay, and this kind of the disposable bag should be given, but you keep it in mind, they should be disposed of in a very proper way of following the waste disposal management protocol. Okay, reduce the waiting time in the dental reception and maintain the spacing of 1 meter. Very important for everybody. Have a small number of patients in the reception without relatives. Consider the patient waiting in their cars till the dental chair is made available. Okay, it's better ask patient to wait in their cars, which will be a better place for the patient to wait, especially those dental operatories where the reception areas are small, and high touch surfaces like door knobs, reception chairs, furnitures, it should be very well disinfected after every patient. Very, very important for ask your receptionist to do the disinfection of all those area which probably the patient is going to touch After every patient, they should be disinfected with the help of either the hypochlorite solution, or you can use the bacillol spray. Okay, and this is what I was talking you. Mark the distance at least of the 6 feet in between two chairs, and then what is we call it as a social distancing, or the social, and very important, and ask them to follow those guidelines. Okay, remove all the reading materials from the reception area. Okay, whatever the books are there, the trophies are there, mementos are there which are in the display, all this they should be removed from because it's very hard to disinfect them. Schedule an appointment, leaving a sufficient time for the staff to, so in between two appointments we should have at least 15 to 20 minutes, maybe few recommends at least half an hour to 1 hour. Okay, if you have multiple operatory, use one operatory in a day only. That's the best way how you can prevent the infection. Okay, patient should be requested to have a mask or nose protection worn in the reception till they are called. If they don't have the mask, you have to provide them the mask. The receptionist should be wearing head caps, eye protection glasses, mask, and the full sleeved apron or the scrubs or the gowns. Okay, and they should also perform the hand hygiene or the sanitization procedures after every patient. Okay, very important for them. Okay, now we are coming to the most important thing, that is the preparation of a dental operatory, and there are many protocols. As I mentioned you, everybody has given their protocol, but what is important, what is feasible for us, that we should choose, and then we can modify our clinic. We need to sometimes modify the infrastructures also to manage this particular pandemic, what we call COVID-19. Okay, now these are the infection control measures which are given by the World Health Organization. Encourage the healthcare workers to have a high level of the clinical suspension. Okay, you inform your assistants, attendants, the doctors that try to treat every patient as a COVID positive or a suspected symptomatic patient or a COVID carrier patient. Okay, so clinical suspension is very important, and they will take all the precautions. Establish a well-equipped triage station at the entrance to facilitate the support of the trained staff. And there has to be the institutional guidelines. Every dental clinic, they should have their own guidelines. As I have mentioned you, the questionnaire also, which you can also prepare according to your needs. And we should have the post signages in the public areas, especially in the reception areas. And one I have shown you in my previous slide, we can have such type of signages. Okay, you can post those signages to the patient before they report to our. And very important is what the guidelines say. We must appoint one person as a infection control protocol officer. Okay, he should be made responsible for every infection control procedures, right from the patient's entry till the patient goes out, disinfection, sterilization of the. So now there are different environmental cleaning and disinfectant solutions which are available. The most effective, which I have mentioned, I am going to talk about this in detail, the quaternary ammonium. Okay, this particular quaternary ammonium is used in fogging. Okay, we are going to talk about the fogging. Okay, what is fogging? Okay, the quaternary ammonium solution is the best way. Then the bleaching, like sodium hypochlorite solution, then the hydrogen peroxide, okay, H2O2, and the 70% ethanol based, okay, with the 2% chloroxidine, or any hand sanitizer which is alcohol based, where minimum concentration of the ethanol is 70%. So these are the important things, and you can see in this diagram 4 ways how to destroy the coronavirus. The first I have already mentioned, the soap and water is the best, and you know the reason why soap is best. Then the bleaching solution, that is the sodium hypochlorite. Okay, 1% is the recommended concentration, depending upon what kind of thing, like if you want to use for the floor mopping, if you want to use the disinfection of your chair. So depending upon the purpose, we can dilute that sodium hypochlorite, which is comparatively a very cost effective solution. Then the alcohol sanitizers, and then the hydrogen peroxide. Okay, so we can ask the patient to use the hydrogen peroxide as a mouthwash also, which actually can destroy the load of the viruses which is there in the oral cavity. Okay, so these are all the things which we should use for the proper disinfection and the sterilization protocol, following the protocols. Okay, and this is what I was trying to tell you, the fogger. Okay, if you see any major surgical operative in the super specialty hospitals, like in a cardiac or cardiothoracic OT, in a joint replacement OT, or in kidney transplant or the organ transplant or operation theaters, operatory rooms, the fogging is the best way of disinfecting that particular operatory room. Okay, and that is what, and the fogging, they use the quaternary ammonium solution, and that is the 100% perfect way of disinfecting your dental operatory, and that is how we can build up our own confidence as well as the patient's confidence also. Okay, there are other few methods which we are going to talk about disinfecting the operatories. Okay, now you can see on my diagram the most vulnerable areas as far as the dental chairs are concerned. These are the light, the dental light, okay, the light of the chair, then the backrest and the seat rest, and the different knobs which are available on the control panel of your dental chair. Okay, because we are touching them very frequently, they are the most important areas where there is always a possibility of a transmission of the virus, and that may get transmitted to the patient and to the dental operatory, or to the dental assistant, or to the dental doctor. Okay, so preparation of this surface is very important. Okay, how we can do that? You can use different disinfectant solutions. I told you, like the sodium hypochlorite, but the disadvantage of the sodium hypochlorite is basically it's a bleaching water, and it may change the color of your backrest if it is having some cloth like material. Okay, so another important solution what you can use is the bacillol. Okay, in our operatory we use the bacillol to disinfect the chair. I will show you on the video. Okay, and you can use the clean sheets what I have mentioned you, cover the complete area with the help of those clean sheets. Basically they are the roll which is available, and you can just cut with the help of the blood and discard them after every use, or maybe at the end of the day. Okay, so depending upon what kind of practices you are doing, if it's a instruments, every instrument should be packed in the rolls. Okay, it should be properly packed, it should be properly autoclaved, it should be properly autoclaved in a B class autoclave, and then it should be available for the use in every patient. Okay, because this is very important to prevent the transmission as well as to ourself. Okay, now till now what we were doing, we were using the four-handed dentistry. As you can see here, now what is this four-handed dentistry? So there is a dental personnel, the doctor who is actually doing the treatment, and there is another person who is assisting, that what we call it as a first assistant to the dentist. Okay, now we have to move from the four-handed dentistry to the six-handed dentistry. Now what is this six-handed dentistry? You can see on the picture on the right side, there is the operator's zone here. This particular zone is a static zone where all the instruments can be kept. Okay, this particular zone is called as the assistant's zone, and this particular zone is a transfer zone. Okay, so there will be a second assistant, what we call it is an unscrubbed assistant. Okay, so the doctor and the first assistant, they will be actually having the personal protection equipments, they will be wearing all the PPEs. Okay, and the second assistant, who is an unscrubbed assistant, he will help you in giving the instruments, in giving the materials, because you know in dentistry we need different materials. So take an example, you want to do a composite filling. Okay, and say you are treating a patient, and if you will just pick up a syringe of a composite material, what happens? There is a possibility that the whole material get infected. Okay, so your second assistant will give you the actual amount of the material, composite material, which is required to you, so that, and then at the end of the procedure you discard that complete material. Whatever the disposables are there, they should be discarded. Okay, we'll talk about this in the future. Okay, hand scrubbing technique, everybody knows about this. We should follow a very nice hand scrubbing technique, and the best hand scrub which is available today is either you can use a soap solution, or as a dental surgeon or as a maxillofacial surgeon, I will recommend you the betadine. Okay, betadine is very potentially effective against reducing the load of the virus. Okay, so betadine is very frequently used as a mouthwash also, because that will reduce, that will actually kill the virus, and that will reduce the viral load in the oral cavity, and the betadine, which is available as a mouthwash, which is available as a scrub also. So that also can be used as one of the best method for doing the scrubbing of your hand technique. Okay, the preparation of the dental surgeon, as I told you, like PPE, everybody today knows about the PPE. These are just the diagrammatic representation, but I am going to talk about the PPE in details. Okay, and you can just see how a doctor is prepared to change to actually do the patients. Okay, now the PPEs can be classified in three ways, three categories: the primary protection PPE, the secondary protection PPE, and the tertiary protection PPE. Okay, now primary protection PPE, basically they are the standard protection for the staff in the clinic, which includes disposable working cap, surgical mask, latex nitrile gloves, white sleeve, full sleeve apron, protection goggles, or the face shields. Okay, and the secondary protection kits, which are basically in addition to the one which is for the primary protection, it has to add the disposable gowns, head cover, and the shoes cover. Okay, and tertiary protection kits, basically they are the highest standard which are used in the COVID wards. Okay, so all those frontline workers who are actually treating the patients, they need to have the tertiary protection kits. Okay, we are going to talk, I'll show you diagrammatically what are the things which are available in this. Okay, so for our staff, like the receptionist and the second assistant, we can provide them a primary protection PPE kits, and for the first the doctor and the first assistant, we can provide them the secondary protection kits. Okay, so this is, and you can see on my screen the PPE. Okay, so the basic kit, like where the quality is described depending upon how much is the thickness of the cloth, okay, which is used for the fabrication of this PPE kit. Okay, as far as the Indians are concerned, we should have two important certifications, that is CITRA from the Coimbatore and the DRDE. So these are the two important standardized certifications which are given by the government of India. We should try to procure the PPEs with these two certifications, which 100% are protected. Okay, which are the certified kits. Okay, so basic, where 45 GSM cloth is used, which can be used. We as a dental operators, we have to use a medium PPE equipments with a 60 GSM minimum is the thickness which is required, and the advanced kit, I told you, like it is used in either ICU or the COVID-19 wards, where the thickness of the cloth is 100 GSM. Okay, so this is the second one is recommended for we, the dental surgeons or the dental operatory or the dental healthcare worker providers. Okay, now this is what I was telling you. The mask is very, very mandatory and important. Okay, and we have the different types of the mask. Okay, the surgical mask, 3-layered mask, FPP mask, and the N95 respirator or the N99 respirators. Okay, and you can see on the diagram, okay, here, if the patient is a COVID carrier and the patient and the healthcare workers, they are not using the mask, there is a 90% possibility of the transmission of this particular disease from a patient to the healthcare worker. Okay, now if the patient is a health carrier, if the patient is a COVID carrier and he is without a mask, but the doctor is with a mask, then still there is a possibility of transmission of disease 70%. Okay, now if the patient is a carrier where the patient is wearing a mask, but the health person is still avoiding using a mask, or he is not using a proper N95 respirator, the possibility drastically drops down. That is a 5%. And I told you in the beginning, if the patient is a carrier who is also wearing a proper mask and the healthcare worker who is also using a proper mask, the possibility of transmission of this disease is only 1.5%. So what is the take-home message is, every patient, every dental healthcare personnel should wear the proper certified masks. Okay, and I'm going to talk about the masks in a little bit more details because we don't have much knowledge about the mask. Okay, this is a mask, the example of a mask, N95 mask with a respirator which is added in this particular. You can see on the top there is a respirator in this particular mask. Okay, now there is a difference between the valve. The respirator is also called as a mask with a valve and the mask without a valve. Okay, so for us, like when it is a mask without a valve and with a valve, the filtration will be from the valve. Okay, in the valve mask, and there will be the inbuilt fibers. Okay, so these are basically, there are different technology. The fibers which are used, the nanofibers are used, 5-6 layers of the fibers which are there in the non-valve mask. Okay, the weight is comparatively, it is more bulkier in the valve mask. It will be, the non-valve mask will be comparatively less weight. Okay, breathing will be more easier in 95 mask with a valve, but it will be comparatively less in the non-valve mask. Okay, it will be more comfortable for the operator. This will be less comfortable. The recommendation for the people with the lung disease, yes, we should have with a respirator or with a valve. And basically suitable for the COVID-19 patient. With a valve it is not suitable, because through the wall also there is a possibility of the transmission of the disease. Okay, so what is a recommended mask as a dental surgeon, as a patient is concerned, is we should use a mask without a valve, and basically it is a N95 properly certified. I have told you, like DRD or Citra certified mask. Reasonably good companies, they are having all these certifications, should be recommended, should be used for the patients. Okay, now it is very important, because we are not used to wear the PPE kit. Okay, so wearing the PPE kit and taking of the PPE kit, that is also called as the donning of the PPE for the dental healthcare personnel, and the doffing of the PPE kit for the dental healthcare personnel. Okay, I mentioned in my previous slides, like the designing of the dental hospital or the dental clinic, dental operatory, we should have a separate area for the donning of the PPE. We should have the separate area for the doffing of the PPE. Okay, you can see on my screen when you start donning and the doffing, because it will take more time. But, and you can just Google, there are multiple videos which are available on the YouTube, on the social media, how to do the donning and the doffing of the PPE kit. Okay, the very simple is, at the end we should wear the mask. We should wear the mask. Okay, once you are ready, you should wear the shoe covers, then do the hand wash, then use your mask N95, wear your cap, then again you can have another mask on your N95, that is a surgical mask. What is recommendation is, use N95 first, on the top of that use another surgical mask. When the procedure is over, you can just throw out the 3-layered triple layer surgical mask what we were routinely using before the COVID-19 pandemic. Okay, put on the goggles, then we have to put on the head shields, and then gown, and then the last will be again do the sanitization with the help of the alcohol based disinfectant, and then put on the gloves. Okay, we should always take care, there has to be 2 gloves. Okay, the first one and the second one. Okay, and during the doffing, again the first gloves will be removed, the second gloves will be removed, then you to take out the doffing, the all these personal precaution equipments, and then at the end again take out your second glove pair, and then do the hand sanitization procedure. Okay, so this is how the donning and the doffing of the kit is there. Okay, now when you want to take the patient, the precautions, receive the patient in the operatory and ask him to disinfect his hand and face by thoroughly washing with the soap and water. Okay, patients might be reluctant. Okay, so what is recommendation is, if you can create a wash basin in the entrance of your dental operatory, that will be the best way. Before you allow the patient to enter into your dental operatory in the reception area, ask him, provide him a basin where he will wash his hand properly with the help of the soap. Then the patient should be asked to gargle. I mentioned you, like hydrogen peroxide is very effective, and the betadine. Okay, so 0.2% betadine solution to reduce the viral load in the oral cavity and the saliva and the mouth. The dentist and the assistant staff, the dentist and the first assistant should use the personal protection equipments, and I have already told you the second degree personal protection equipments, they are recommended. The patient should be draped with the disposable or the autoclavable drapes after he performs rinsing. Use of aerosol precautions, causing equipments like the aerators, 3-way syringes, and the ultrasonic scaler should be avoided or the minimized. Okay, now what is the recommendation? If you really want to use the aerosol, we should plan that particular appointment at the end. Okay, we'll talk about that. Okay, now it's very important. You can see, adapt to adopt. Okay, we were not used to all these things before the COVID-19 pandemic. Okay, there, because this particular virus get transmitted through the oral cavity, through the salivary droplets. We have to adapt the policies, means prepare the policies for your dental operatory, for your dental staff, and adopt all those policies in your dental clinic, so that everybody will be safe. And that is what we call it as adapt to adopt. Okay, very very important. Adopt what you can do and adapt the rest. Okay, so the dentist and the assistant staff should avoid touching other surfaces with saliva or the blood contaminated gloves once you start treating the patient, which you will be avoiding. And that's the reason why I told you, like, there has to be second unscrubbed assistant. Okay, he will help you in adjusting the chairs and all these things. Okay, all surfaces and the equipments which cannot be autoclaved or chemically disinfected, like the knobs, the buttons, houses, electronic equipments, dental light grips, etc., should be covered with the barriers, which should be changed after every patient. All the drill handpieces, scaler handpieces, endo equipments, motors, burrs, they should be autoclaved as per as the recommendations of the providers, or we can use a formalin chamber. You know, like in operation theaters or in operating room, the formalin chambers are used. Okay, so those instruments which cannot be autoclaved, they should be kept in the formalin chambers. Okay, after the procedure is complete, the dentist and the assistant should thoroughly wash the gloved hands with a soap and alcohol-based disinfectants. The disposable, and that should be done. The disposables worn by the patient and the dentist should be removed and disposed with the washed gloved hands. The patient should be advised to wear his mask immediately after the procedure. And once the PPAs are taken off, remove the gloves and again perform the hand hygiene procedures. This is basically which protocol of the doffing of the PPE. Okay. Now, what are the guidelines for the dental assistant? The assistant should clear all the used equipments with the disposables, with the gloved hands, and all the PP1. The instrument should be left in a covered tray with a sodium hypochlorite. Prepare the boxes, okay, and add the sodium hypochlorite 1%, dilute it to 1%, and immerse those instruments for 20 to 30 minutes. Keep them in that particular box of the sodium hypochlorite. And the disposable, including the needles, syringes, blades, they should be properly disposed of as per the biomedical waste protocols, which everybody knows. I will just mention about this in the subsequent slide. And all the surfaces where you feel that they are contaminated, like the chair, the furnitures, the suction, they should be thoroughly cleaned with the help of the alcohol-based disinfectant solutions. Okay, or you can use the bacillol or the sodium hypochlorite. Okay, once the procedure is over, open the window and allow anyone to enter, and don't allow anyone to enter. It's very very important. Like, now you did say 3 patients in a day, and your last patient was the aerosol generating procedures. Okay, and as I mentioned you in the beginning, this particular aerosol which is there in the air of the operatory, it takes at least 15 minutes to 20 minutes to get settled down to the surface or to the floor. Okay, so what is the recommendation is, you open up the window, a proper ventilation has to be there. Okay, there are multiple guidelines which are given by the American Dental Association, where they said you do the patients in a negative suction operatories. Okay, but that may not be possible in some dental operatories. Okay, so we let us settle down the aerosol, and after 15 to 20 minutes, you ask your assistant to prepare the operatory for the next patient. Okay, the floor should be very nicely cleaned with the sodium hypochlorite and the detergent. The dental operatory and the reception should be fumigated every day. Okay, before you close. So my recommendation is, after in the morning, once you finish up, fumigate it with the help of your fogger or your fumigator, and in the evening also, once you finish up, or if it's a day whole day practice, and before you go, you prepare the operatory for the next day so that it will be ready. Okay, now you cannot avoid the aerosol generating procedures. Okay, and everybody knows what are the ways how the aerosol can be generated in the dental practice. The one is the ultrasonic scaler, the second is your air rotor handpieces, and the third one is your 3-way syringes. Okay, that is how. So there are and I told you, like, the povidone iodine has also been proven to be very safe, which we have already discussed, and effective for the use and antiseptic hand wash for the healthcare workers. Okay, the data against the similar coronavirus, definitive confirmation of the efficacy of the povidone iodine antiseptic range of the protocol against the use in the COVID virus is not yet 100% proven, but there are publications which are coming out where the povidone iodine is recommended to reduce the viral load for the dental healthcare personals, as well as to reduce the viral load in the oral cavity also. Okay. Now, what are the protocols we are supposed to follow for reducing the aerosol in the dental operatory? We can use the high vacuum suctions. I will show you. N95 mask, which we have already discussed about this. The rubber dam, okay. We have to equip our operatories with the help of the HEPA filters. We'll talk about this, and the UV light sterilization. Okay. The papers which are coming up, UV light is supposed to be one of the best method of disinfecting this particular virus, what we call it as a COVID-19. Okay. And as I mentioned, like aerosol generating procedures should be scheduled as the last appointment of the day whenever you want to do, say you want to do a crown cutting, you want to do a root canal opening. So such type of appointment should be scheduled at the last. Okay. This is how when you do the procedure, the aerosol which might not be visible to you, but it is generated with the help of your air rotors, and there are high vacuum suction machines which are available nowadays. So when you are doing the procedure, the high vacuum suction should be used in the vicinity of the procedure where most of the aerosol can be sucked through these machines, and these machines also have the HEPA filters in these. Okay. And you can just Google, you will be in a position to see how actually this machine works. Okay. So this is the first recommendation. Now, infection control measures for aerosol generating procedures, as I mentioned about you this, we should use then these are the recommendations which are given by the American Dental Association, ADA. Okay. So natural ventilation with airflow of at least 160 liters per second per patient. Okay. And as I was mentioning you, they have recommended the negative pressure room with at least 12 air changes per hour. Okay. So these are all the things. N95 mask, we talked about these. Okay. So all these things can be followed. And the rubber dam isolation, as we talked about, the rubber dam can be significant minimize the procedures of the saliva and the blood contaminated aerosols. Okay. When rubber dam is applied, extra high vacuum suction, this will definitely reduce the generation of the aerosol. Okay. Now HEPA, okay, high efficiency particulate air filters. Okay, they are coming up like anything in the market. Okay, basically these HEPA filters, they are used in our operating room, in your operating room or the operation theaters. Okay, all the operating theaters, they have the HEPA filters and the laminar airflow. Okay, that is nothing but a negative air pressure. Okay. So we'll talk about this. Everybody should know in little bit about this. So common standard required that the HEPA air filter have 99.97% filtration of the particles whose diameter is equivalent to 0.3 micrometers. Okay. So HEPA filters are critical in prevention of the spread of the airborne bacterial and the viral organisms, and therefore this is very effective in preventing the transmission in the COVID-19 virus also. Typically, medical use of the HEPA filters, as I mentioned you, in the operation theaters, systems also incorporate a high energy UV light. So HEPA filters with a UV light or panels with the antimicrobial coating to kill off the live bacteria or the virus trapped by the HEPA filter. Okay. So HEPA filters in combination with the UV lights also can give you a better way of disinfecting your dental operatory I'm talking about. Okay. Now, does UV light kills the SARS-CoV-2 virus? Okay. Yes. The UV light, that is ultraviolet germicidal irradiation, UVGI, is a disinfection method that uses the short wavelength UV, okay, light to kill the or inactivate the microorganism. Basically, when this UV light comes in contact with the ribonucleic acid, it disturbs the DNA and the RNA, leaving them unable to perform the vital cell functions. Okay. So now what are the recommendations which are coming up? Once you prepare your operatory for the next day, you add UV lights in your dental operatory, keep them throughout the night. Whatever the remaining viral load or the bacterial load is there in the dental operatory, that will be taken care by these UV lights. Okay. the recent study which is presented and confirmed that the UV rays damage the SARS-CoV-2 virus genetic material and quickly deactivate the virus. Okay, so the recommendation is we should at least install 1 or 2 UV lights in every dental operatory. Even you can install them in your reception areas, in your green rooms, and like I told you, like the green, red, and the orange zones everywhere. UV light, they are not very costly also. Okay, so and what is the recommendation is the UV light which is in a velocity, okay, the wavelength, what we call it is a wavelength, about 185 to 265 nanometers. They are very effective in reducing the viral load or making these viruses inactive by actually destroying the ribonucleic acid and DNA or the RNA microorganisms, either the bacteria or the viruses. Okay, so this is the importance of the UV lights in. Okay, now there are multiple institutions who are coming with the boxes like. Okay, so this is the box what we have prepared in our institution. We have named them as a SA safety box. Okay, basically there is a article which is published in a pulmonology journal, where one of the pulmonologists, he prepared this type of a box and named it as a Arbut safety box, basically for the intubation. We modified this particular box and we named it as a SAAS safety box. Okay, what is this SAAS? It is we are the 4 people who are involved, and these are the initials of our names. SAAS. Okay, Subodh, Abhay, Shikha, and Amit. So this is the safety box. You can design according to your own requirement, and that will also help in reducing your aerosol procedure. Okay. Now once the procedures are done, after dental care, clean up the PPE with the soap water, disinfect the reusable face protective equipments. Okay, non-dedicated and the non-disposable equipments like the handpieces, dental X-ray units, dental chairs, they should be disinfected as per the manufacturer's instructions. You can use the hypochlorite or the bacillol. The handpieces should be clean to remove the debris, followed by the heat method of the sterilization. Okay, autoclaving is the best way of sterilization as far as the dental procedures are concerned. Okay, the post-pandemic considerations. Once this pandemic will reduce, okay, when we got out of this pandemic and resume our dental treatments, okay, we must treat every patient visiting to our office to be a COVID-19 positive and follow all the standard operating procedures. You can prepare your own SOPs for your own use, for your own dental operatory, on your own dental institutions. Okay, so and it's very important to build a confidence in our patients, as well as to build a confidence of our own, as well as the confidence of our clinical staff. We should follow all these standard operating protocols operating. That is what we call it as the SOPs in a post-pandemic considerations. And in my opinion, this will not go, and we have to make a habit of living with a coronavirus. Okay, so it is better to protect us with all the SOPs what we have discussed in the previous slides. Okay, now I told you like waste management protocols. This is just a diagrammatic representation. Probably all of us must be knowing. The most important thing what I want to tell you, you can just search it again. You will have what color code, what are the things you are supposed to dispose of. Okay, but the sharp needles and the other sharp blades, they should be disposed of in a puncture proof container. Okay, keep it in mind. Okay, you prepare a puncture proof container, all those sharps, they should be disposed of in a puncture proof container. Okay, now when going to the home, once your procedures are over, what the dental health, from the scrub to the personal clothing before you return the home. So what is our recommendation is, when you to go to the dental operatory, change your clothes. Okay, use the clothes like how we do for the operating room or the operation theaters. You should have another scrubs, what we call them as the scrubs. And when you come back again, you change those scrubs, keep those scrubs in the clinics, and then change your routine clothes, come to the home. Upon arrival, the DCPH should take off the shoes, remove and wash the clothing. Okay, directly entry to your washrooms. Okay, don't touch here and there. You can ask somebody to give you again the hand sanitization, like the sterilium or the alcohol based hand sanitizer, and then without touching anything, you can enter into your washroom, take a nice shower with a shampoo, a good soap, and then with a warm water. Okay, and this is how the whatever. And then very another recommendation is, whatever the cloths you want, they should be sent for washing, and preferably they should not be added to our routine family cloths. Okay, they should be washed separately. Okay, now what are the interventions for exposed healthcare? Suppose by chance you feel that the possibility of exposure is there, so it can be divided as a high risk for the infection and the low risk for the intervention on that. Okay, and the recommended guidelines which are given by the WHO: stop all healthcare interactions with the patient for 14 days. So some sit you feel that you got exposed to this, you have to take a proper advice, get yourself quarantine, test yourself for the COVID-19, quarantine for the 14 days. Okay, then provide the psychosocial support, provide the compensation for a period of the quarantine. Okay, provide the review of the institutional protocols. Okay, training and all these things. Okay, and the low risk, what you should do is, you should do a self monitoring, like the temperature and the respiratory symptoms. We the dentists, we know how to monitor the temperature and the respiratory symptoms. Then inform the facility if the symptom develops, reinforce the contact and the droplet precautions, reinforce the airborne precautions, reinforce the rational correction and the consistent use of the PPE, apply WHO's the 5 movements of for the hand hygiene, and practice respiratory equity protocols. Okay, so these are the interventions if you suspect the possibility of your exposure to the COVID-19 patient. Okay, now the sky is the limit. Okay, whatever you do, whatever the precautions you are taking, there the you cannot prevent the possibility of the transmission of the disease. Okay, and what the best you can do is, you have to boost up your immunity. Okay, that's the best way how you can do, you can take your own care. Okay, it is said that the self care is the best care. Okay, you have to take your own care, and there are so many protocols how we can boost up our immunity. Okay, so and what are the things? Before that, I would like to just mention, you can see on my diagram, on my screen, there are two diagrams. You know, in our body, there are two systems: the autonomous nervous systems, which is divided as a sympathetic pathway and the parasympathetic pathway. Okay, everybody knows the sympathetic pathway, it is a fight and the flight response, and whenever there is a stress, the sympathetic activity gets stimulated. Okay, and there will be a release of the adrenaline in the body. Okay, there will be rush of the adrenaline, everybody knows, like how it happens in the syncope. Okay, and in the parasympathetic stimulus, it is what we call it the rest and the digest or the waging. And whenever there is a parasympathetic stimulus, there will be a rest, a feeling of the rest. Okay, the patient will be stress free. So what is the recommendation is, try to balance the sympathetic and the parasympathetic stimulus. Everybody is under a tremendous pressure today. Everybody might be in a phase of depression. Okay, and what are the reasons? Because of this tremendous pressure, the sympathetic activity is more activated. Okay, so try to reduce the sympathetic activity, try to enhance the parasympathetic activity. Now, why you want to enhance the parasympathetic activity? Because when the parasympathetic activity is enhanced, okay, like in sympathetic activity, there is adrenaline rush. In a parasympathetic activity, there are 4 very important hormones which are secreted in the body. They are the serotonin, dopamine, oxytocin, and endorphins. Okay, so and these hormones, they are called as the happy hormones of the body. Okay, so balance the adrenaline rush and the happy hormones in your body, activate your parasympathetic activity. And what are the things you can do to activate your parasympathetic activities? Everybody knows about this. Like you can do yoga, you can do, those who are the gym lovers, they can do the regular exercises. You can do a meditation. What I will recommend, do 2 times meditation, 20 minutes in the morning, 20 minutes in the evening before you go for the sleep. Start your day with a meditation and end your day with the meditation, and that is the best medicine for everybody. Okay, and obviously take a healthy food, don't go for the junk food, and whatever the healthy you think should be taken. Everybody knows like what is the healthy food: more vegetables, more fruits. Okay, junk food should be avoided, and that is how we can boost up our immunity. You can add on the vitamin C, multivitamins, the vitamin D. All these things can be added to boost up or to increase our immunity, and that is, I told you, that is the best way of taking your own care. Okay. Now to conclude, sky is the limit to incorporate the methods and the equipments like the aerosol removing, air purifying with the HEPA filters, PPEs to be used in the high risk categories like the Z kits for the personal protection. Okay. So we need to augment all the procedures in our dental operatory so that we can do a dental procedure with utmost precautions without transmitting this particular COVID-19 coronavirus to our own dental healthcare personnel and to our patients. Okay. And these are few infection control measures established and implementing. These are the basically these are the administrative policies. Okay. So these are the things to be taken care by the administrators, and I mentioned you in the beginning, appoint somebody who will be infection control protocol officer in your dental operatory. Okay. So all these things should be followed as the administrative level. Okay. And these are the infection control measures, like we should have the adequate training of the healthcare workers, ensure an adequate patient to staff ratio, very important. Initially, I told you, like 400 dentistry was there, now recommended is the 600 dentistry. So you have to add one more assistant. Okay. So you have to increase the staff. Okay. All these things you need to monitor, we need to balance, monitor the healthcare workers dental health for the compliance and providing the mechanism for improvement. Okay. So every day train them, and these are all the administrative policies which we need to follow. Okay. Thank you so much, dear doctors, for joining me on this webinar. I would like to show you two videos which are prepared in our dental clinics, which are very, very important. And then we can have some questions, and then we can conclude this session. And before I would conclude, I would like to give a quotation: "No Corona, go Corona." Okay. As I mentioned in my presentation, we have to make a habit of living with the corona. We cannot live the corona, but we have to make a habit of living with the corona. Okay. Thank you so much for joining me in this webinar. Okay. So just give me a minute, and I will show you two videos, and then we can have, you can see, like you can prepare your own videos. So this is the prepare video which we have prepared. Basically, this video you can prepare and send it to your patient along with the questionnaires what I have shown you, like what are the things he is supposed to do when he enters into your clinic. Okay. When the patient enters into the clinic, as I told you, the first thing what you are supposed to do is check his temperature. Okay. And this is non-touch instruments, infrared thermometers. Okay. After that, you ask the patient to do a hand sanitization protocol, and this is the machine, as I mentioned, the non-touchable hand sanitizer dispenser, where the alcohol-based disinfectant, ask him to prepare. Then after he sanitizes his hand, use your pulse oximeter to check SpO2 level. And I mentioned in the beginning, like why SpO2 level is important. Okay. And once the SpO2 is done and you think everything is, ask the patient, preferably you can ask him to change the mask. Okay. Because we don't know what is the mask he is using. Ask him to use the shoe covers, you can see in this particular video. And then again, fill those declarations. Okay. The forms, the consent, the declarations, everything should be filled. And once the patient is ready, escort, ask your receptionist, and you can see the receptionist also is well prepared with all the PPEs. Okay. Preferably, he is not going to touch any part of your handovers. Wash the hand properly. Then, if he is having the mobiles, they should be kept in a tray. Again, sanitize his hands. Drape the patient properly. You can see here the disposable drape, and then your surgical sterile drape. Okay. So this disposable we can discard once the procedure is over, and this surgical sterile drape which we are using, so, or you can even use the the non-sterile drapes also. Okay, and before that, ask the patient to take out his mask. Okay, and betadine mouthwash, as I told you, 2%, which is going to reduce the viral load. And once the patient is prepared, your dental surgeon, you can see here the dental person and the first assistant. And there is a second assistant, what you can see here, who is usually in a transition zone, okay, who will actually give you the instruments, equipments, and these two persons, they will not touch anything. Okay, now once the procedure is over, immediately ask the patient to wear the mask, take out his first gown, and then you will escort the patient to your waiting area, reception area. Okay, and everything is done when the patient is ready to go to the home. Okay, whatever the disposables he has used, you can ask him to continue with the same mask or the cap if wish. And this is what I was trying to mention you, the social distancing. Okay, if you have a bigger operatory, you can mark the areas. Okay, so such type of videos can be prepared by every dental surgeon, which can be sent. And the second video, as what I want to show you, is like the sterilization and the disinfection protocols. Very, very important. We need to upgrade our sterilization and disinfection protocols. Okay, and you can see here what we actually do. Once the patient is done, okay, you can see after the procedure is over, I told you, like, the instruments, open up the windows, wait for 20 minutes, get the room ventilated. After that, your assistant will enter inside, keep those instruments in a hypochlorite box. Whatever the disposables are there, they should be carried. You can see here the remaining mouthwash or the water, it should be discarded. Pour 1% sodium hypochlorite to disinfect the spittoon. Okay, very, very important. Okay, then with the help of the either Bacillol spray or the hypochlorite spray, the complete chair is disinfected. All those area where you think that you have touched or the patient have touched, especially the light handles, the mops, the knobs, the operating areas, the handles of the chair, everything should be properly disinfected. Okay, so it's very important. The video itself is a self-explanatory, and all these things are done, and then wipe it properly. Okay, and then I told you, like, with the help of a sodium hypochlorite, the floor also needs to be properly prepared. And once this is prepared, close your ventilated windows, do the fogging with the help of a quaternary ammonium solution. This is a fogger which we have to add into our instrument, equipment, gadgets. Okay, and fogging is the best. And this is, you can see how nicely the operatory is fogged. Okay, then the instruments will be properly washed by our assistant, the first assistant. Use the soap-based solutions. Here also you can see the soap-based solutions are also used. Wash them properly. After washing, what you have to do is put those instruments in an ultrasonic cleaner. Okay, whatever the debris are there, they will be totally clean in the ultrasonic cleaner. After that, dry the instruments. You can see with the help of a cloth. After drying, you do the packing of the instruments. This is the way. This is the video which we have prepared for our own institute. And okay, then preferably use a B-class autoclave. Follow the standard cycle for the autoclaving, that is 30 minutes for 150 psi pressure for and then these are the instruments which are ready for your patient's use. Okay, what is important here is we need to take or gain the confidence of our patients, and this is the dental operatory which is ready for your next patient. Okay, and very important is we have to take the confidence of the patient. Okay, so with this I would like to conclude my webinar. We'll take few questions. First question is start live. Vaishali Venkat, when should we ideally treat a patient who just recover from the viral infection? Okay, so when you want to treat a patient who is recovered from the viral infection, what is the advice is the patient has completely followed his quarantine time, that is 14 days to 21 days, and since last 1 week the patient is asymptomatic and whose last test was negative. Okay, that time you can take the patient for your dental treatment. Are all these informations available in the book advised by you? Yes, we try to cover up all the informations what I have spoken in my webinar. They are already available in the manual which we have published. How to treat an emergency cases? Yes, we have to treat the dental emergencies, and as I told you, all the emergencies, they should be treated by using the utmost precautions, by wearing the personal protective equipments and following all the guidelines what we have described in or discussed in this particular webinar.